Which of the following is the most common cause of renal injury during cardiopulmonary bypass? A. Direct nephrotoxic drug exposure. B. Ischemia-reperfusion injury. C. Immune complex deposition. D. Obstructive uropathy. Answer: B. Ischemia-reperfusion injury. Explanation: renal injury during CPB is most commonly due to ischemia-reperfusion injury caused by hypotension, hemodilution, and non-pulsatile flow. These lead to tubular damage and reduced perfusion of the renal cortex and medulla. Nephrotoxic drugs and immune causes are less common in this setting. Which organ is most susceptible to embolic injury during cardiopulmonary bypass? A. Liver. B. Brain. C. Kidneys. D. Lungs. Answer: B. Brain. Explanation: the brain is highly sensitive to microembolic events, which can occur during CPB due to air bubbles, platelet aggregates, or atheromatous debris. This can lead to stroke, cognitive dysfunction, or delirium postoperatively. What is the primary mechanism of lung injury during CPB? A. Bronchospasm. B. Atelectasis from cardioplegia. C. Systemic inflammatory response. D. Barotrauma from ventilator settings. Answer: C. Systemic inflammatory response. Explanation: CPB triggers a systemic inflammatory response syndrome, SIRS, which contributes to increased pulmonary vascular permeability, edema, and impaired gas exchange. This leads to post-perfusion lung syndrome or acute lung injury. Which strategy is least likely to prevent neurologic complications during CPB? A. Maintaining perfusion pressure. B. Use of arterial filters. C. Deep hypothermia without EEG monitoring. D. Avoiding prolonged aortic cross-clamp time. Answer: C. Deep hypothermia without EEG monitoring. Explanation: while hypothermia reduces metabolic demand, unmonitored deep hypothermia can increase risk of neurological injury due to inadequate cerebral perfusion. EEG monitoring helps tailor perfusion and temperature strategies. Maintaining perfusion pressure and using filters help reduce embolic events. Gastrointestinal complications after CPB are primarily associated with which factor? A. Excessive heparin dosing. B. Non-pulsatile perfusion and hypoperfusion. C. Hemodilution. D. High-dose corticosteroids. Answer: B. Non-pulsatile perfusion and hypoperfusion. Explanation: splanchnic hypoperfusion during CPB can lead to GI complications such as ischemic bowel, hepatic dysfunction, or stress ulcers. The gut is particularly sensitive to reduced flow during bypass. Which of the following biomarkers is most useful for early detection of acute kidney injury, AKI, post-CPB? A. Creatinine. B. Troponin. C. Neutrophil gelatinase-associated lipocolin, NGAL. D. ALT. Answer: C. Neutrophil gelatinase-associated lipocolin, NGAL. Explanation: NGAL is an early biomarker that rises within a few hours of kidney injury, unlike serum creatinine which rises late. It's useful for early detection and potential early intervention post-CPB. Hepatic dysfunction after CPB is most commonly a result of A. Viral hepatitis reactivation. B. Cholestasis from bile duct obstruction. C. Ischemia due to low flow states. D. Drug-induced liver injury. Answer: C. Ischemia due to low flow states. Explanation: the liver is affected during CPB primarily through reduced splanchnic blood flow and congestion, especially during hypotension or right heart failure. Hepatic enzymes may elevate due to ischemia-reperfusion injury. Which of the following factors most significantly contributes to coagulopathy during CPB? A. Hypercalcemia. B. Hypothermia. C. Hyperkalemia. D. Respiratory alkalosis. Answer: B. Hypothermia. Explanation: hypothermia during CPB reduces enzyme activity, platelet function, and coagulation cascade efficiency, contributing significantly to coagulopathy and bleeding. It is often intentionally induced to reduce metabolic demand but must be carefully managed. What is the role of hemolysis in organ dysfunction during CPB? A. It increases oncotic pressure. B. It decreases bilirubin levels. C. It releases free hemoglobin, causing oxidative stress. D. It enhances platelet aggregation. Answer: C. It releases free hemoglobin, causing oxidative stress. Explanation: mechanical shear stress during CPB can cause hemolysis, releasing free hemoglobin into circulation. This contributes to oxidative stress, especially affecting the kidneys and lungs, and worsens organ dysfunction. Which inflammatory mediator is primarily responsible for systemic inflammatory response during CPB? A. Interleukin-10. B. Transforming growth factor beta. C. Tumor necrosis factor alpha, TNF-alpha. D. Vascular endothelial growth factor. Answer: C. Tumor necrosis factor alpha, TNF-alpha. Explanation: TNF-alpha, along with IL-6 and IL-1 beta, plays a key role in initiating and amplifying the systemic inflammatory response associated with CPB. This contributes to capillary leak, organ edema, and dysfunction.